I am Dr. Krishna Hari. I am working as a senior consultant in Dr. K. Hari's Aster Medicity Satellite Clinic, and also I am associate consultant at the Aster Medicity Satellite Clinic, Kochi. Today, I am going to give a talk on healthy diet for healthy heart. I'll be talking on hypertension and related with that, the diet, what you should follow so that you can protect your heart apart from taking medications too. Hypertension is one of the leading risk factors for global mortality. Around 94 million deaths takes place annually. 594 million hypertensive patients were there in 1975, which increased to 1.13 billion in 2015, and it is still increasing. In today's section, we'll discuss about the role of healthy diet for keeping our heart healthy. Hypertension has no warning signs and symptoms, and many people even do not know that they have it. Thus, it is frequently known as a silent killer. High blood pressure increases the risk of several cardiovascular complications like heart attack, heart failure, arrhythmias, peripheral artery disease, and stroke. Heart disease are the #1 cause of global death. More people die annually from cardiovascular disease than from any other cause. Cardiovascular disease are one of the most common lifestyle diseases. Some of the most prominent factors for increased incidence of heart disease includes sedentary lifestyle, stress, excessive salt intake, junk food, smoking, and excessive intake of alcohol. Normally, in a healthy person, blood pressure rises and falls throughout the day. But pressure higher than the normal for a longer duration can damage vital organs like heart, kidneys, brain, and eyes. Persistent increase in blood pressure higher than the normal blood pressure is known as hypertension. Nowadays, number of safe and effective medicines and procedures are available to treat hypertension and other heart diseases. But let me tell you, all that lifestyle modification like exercise and dietary changes are equally effective as medicines and can also help a person to lower high blood pressure and prevent progression of heart disease. They are the first line and best in managing hypertension. Hence, certain dietary approaches like DASH diet and Mediterranean diet have been engineered to reduce high blood pressure. And we'll just have a talk on DASH diet. Let us see what is a DASH diet. One of the most well-known dietary strategies for lowering the risk of heart disease. DASH stands for Dietary Approaches to Stop Hypertension. It is a diet designed to combat the high blood pressure and reduce risk of heart disease. It emphasizes the right portion, size, and variety of foods and nutrients. Basically, it is an eating plan which is rich in fruits, vegetables, whole grains, fish, poultry, nuts and legumes, and low-fat dairy. It does not require any special or pre-packaged meals. Rather, it relies on many standard foods one may already have in their home. Diet includes more of the foods that are naturally low in salt, cholesterol, and saturated fats, and foods that are high in potassium, calcium, magnesium, and fiber. DASH cuts out desserts, sweetened beverages, fats, red meat, and processed meats. A typical guide for patients following daily and weekly DASH diet and goals for a 2,000 calorie a diet can be grains, 7 to 8 servings a day, lean meats, poultry and fish, 2 or fewer servings a day, vegetables, 4 or 5 servings a day, fruits, 4 to 5 per day servings, and low fat or fat-free dairy products, 2 to 3 servings a day. Total sodium intake around 2,300, but 1,500 milligrams sodium lowers blood pressure even further than 2,300 milligrams sodium daily. Nuts, seeds, and dry beans, 4 to 5 serving a week. Sweet, 5 or less serving a week. This was all about servings of DASH diet. Now, moving on to Mediterranean diet, it has many similarities with the DASH dietary pattern, but is generally high in fat, primarily monosaturated fat from olive oil, nuts, seeds, commonly close to 40% of the daily energy. In addition to this, specific dietary changes are also needed to manage for uncontrolled hypertension. We will discuss these required changes one by one. First is reducing salt intake. We did discuss earlier a bit. High sodium diet is well known to increase blood pressure. Packaged and processed foods are main sources of salt in diet. The human body requires small amount of sodium in the diet, approximately less than 1,500 milligram per day. And most people consume more sodium than they need, more than 3 grams per day. In fact, the less sodium you eat, the better blood pressure control you might have. To lower the sodium in diet, one can try some of the measures like what I am going to tell you now. The first is using a food diary to keep track of the salt in the foods you eat. Then you can also check the increasing the intake of salt-free food such as seasoned fruits. You can also try aiming for less than 2,300 milligram, about 1 teaspoon of salt each day, and also plan for reading the nutritional facts labeled on every food package. Also, you can try avoiding foods that have 20% or more daily value of sodium. And lastly, avoid canned foods, processed foods, junk, and fast foods, etc. Then the second point you have to look into is limiting alcohol intake. Drinking an excessive amount of alcohol increases the risk of developing heart disease. People who consume more than 2 drinks per day have an increased risk of heart complications as compared with non-drinkers. And binge drinking, for example, consuming 4 to 5 drinks within 2 hours is an even greater problem for overall cardiovascular health. Hence, it is very important to lessen alcohol intake to have a healthy heart. And the third point is cutting down number of tea and coffee. Tea and coffee and other caffeine-rich drinks can increase the blood pressure. It is fine to drink tea and coffee as a part of a balanced diet, but it is also important that these drinks are not your main or only source of fluid. Drinking more than 4 cups of coffee a day may increase your blood pressure. Restrict caffeine intake to less than 2 cups of coffee per day. The fourth point is eating more fiber, fruits and vegetables. And on the other hand, the potassium, magnesium, and the fiber may also help control blood pressure. Fruits and vegetables are having high in potassium, magnesium, and fiber, and low in sodium. Many breakfast cereals are excellent source of dietary fiber. Stick to whole fruits and veggies. Juice is less helpful to us because the fiber on the fruit is destroyed and generally has added sugar too. Also, nuts, seeds, legumes, lean meat, and poultry are good source of magnesium. Let us also talk over how these healthy diet plans can improve the cardiac health in patients having cardiovascular complication. Again, there are 4 points you should understand. The first is diet encourages the intake of food that is rich in potassium, magnesium, calcium, and helps in reduction of sodium in the diet to about 1,500 milligram per day. And second point is the DASH diet, which we have already discussed, generally includes about 2,000 calories a day. Due to avoidance of fat-rich food, it reduces triglyceride level, improves HDL, that is the good cholesterol, and also reduces LDL, the bad cholesterol. Hence, can be worked as a successful tool in weight management. It indirectly helps the person to lower high BP and have a healthy heart. Diet plans also cuts intake of sweets and sugar-containing beverages, so lower risk of development of diabetes and other heart disease. So it also improves the health of a patient with heart failure. The healthy diet eating plan is just one key part of the heart healthy lifestyle, and Combining it with the lifestyle changes such as physical activity can help you to have a more control on blood pressure and LDL cholesterol for healthy heart. Accompanying healthy diet, person should also at least 30 minutes of moderate intensity exercise most days of the week. Examples include walking or riding a cycle. A person can aim to get at least 2 hours and 30 minutes of exercise per week. At this time, I would like to suggest some idea that can help you make healthy changes. Don't be discouraged if following the diet is difficult at first, and start with a small achievable goals. Try making 1 or 2 changes at a time until you can do it all. Learn to read the labels so that knowing serving size, you will get to know how much sodium you are getting as per serving. Use spices and herbs to flavor your food instead of salt. Choose fewer processed foods, frozen meal, canned soup, packaged mixes, etc. These contain more sodium. And look for foods that say no salt added or sodium free and low sodium, etc. Avoid fried foods and go for instead grill, steam, roast, or post food. So slow down when you eat. That also will help you. And exercise simultaneously, and that will definitely help you in bringing a good cardiac health. Lastly, the bottom line is that diet plays crucial role not only in developing but also in controlling the progression of the heart disease. I advise to all patients to adopt a healthy lifestyle, which plays an important role in not only treating heart complication but also in preventing it. So my best wishes to you all who can understand this talk very easily and follow it, and you can see the result. Thank you very much.